Hey everyone, welcome back. Tonight, we're drifting all the way back to ancient Egypt, specifically to the life of a physician. Not the glamorous Indiana Jones version of Egypt you might be picturing, but the actual, sweaty, surprisingly bureaucratic reality of trying to keep people alive along the Nile around 1500 BCE. So dim your lights, get comfortable, and let's ease into the decidedly unglamorous world of Egyptian medicine, where your job description included everything from prescribing ground-up mouse paste to explaining why no, you cannot simply pray away that infected tooth. Our physician today, let's call him Peseshet, because that's an actual attested name for an Egyptian doctor, wakes up before dawn. Because of course he does. The sun hasn't even begun its daily journey across the sky in Ra's solar bark, and Peseshet is already awake, staring at the ceiling of his modest mud brick house in Thebes, wondering if today is the day someone finally asks him about a medical problem he actually knows how to solve. See, here's the thing about being a doctor in ancient Egypt. You were very well. The Egyptians were actually quite advanced in their medical knowledge compared to their contemporaries. They understood that the heart pumped blood, They knew how to set broken bones. They even performed surgery. But they also thought your personality lived in your heart. Your emotions came from your intestines. And that most diseases were caused by angry demons, or, alternatively, an excess of something called WHDW, which was basically evil decay matter floating around in your body. So you can imagine the professional frustration. Peseshet gets up, washes his hands and face in a copper basin. Hygiene was actually a big deal for Egyptian physicians, which puts them well ahead of European doctors who, thousands of years later, would be like, wash our hands between patients. Sounds fake, and puts on his simple linen kilt. No elaborate outfit, no white coat equivalent, just a kilt and the quiet dignity of a man who has seen far too many infected foot wounds. He eats a small breakfast of bread and beer. And yes, beer for breakfast was completely normal. The Nile water was often contaminated, so beer, which was thick, nutritious, and had a low alcohol content, was safer. It was basically ancient Gatorade, except it made you slightly tipsy and had the texture of oatmeal. Peseshet's first patient of the day arrives just as the sun begins to crest over the eastern hills. It's a farmer, naturally, because it was almost always a farmer. The man has been suffering from terrible headaches, and he's absolutely convinced that a demon has taken up residence in his skull. Now, Peseshet examines him. He checks his eyes, feels his forehead, asks him to describe the pain. Based on the symptoms, Peseshet suspects it's probably a chronic sinus infection, maybe exacerbated by spending all day bent over in the fields, breathing in dust and grain chaff. But here's the thing. Peseshet can't just say it's an infection. Here's some willow bark tea and try to rest. Because if the patient believes it's a demon, and you don't address the demon, the patient won't feel better. The placebo effect worked in reverse too. So Peseshet does what any reasonable Egyptian physician would do. He prescribes both practical treatment and spiritual intervention. He gives the farmer a poultice of honey and ground herbs to reduce inflammation. Honey was legitimately one of their best antibacterial agents, and they used it constantly, and then he recites an incantation to expel the headache demon. Everyone's happy. The farmer feels heard, the demon feels properly threatened, and Peseshet gets paid in grain. Payment, by the way, was rarely in actual money. Egypt had currency, but for everyday transactions, especially medical ones, it was mostly barter. Grain, beer, linen, the occasional goose. Peseshet once got paid in fish, which was awkward because he didn't particularly like fish, but such was the life of a provincial doctor. His next patient is more complicated. A middle-aged woman from a slightly wealthier family, you can tell because she is wearing more jewelry and her linen is finer, comes in complaining of abdominal pain and irregular bleeding. This is the kind of case where Peseshet has to be very, very careful. He examines her as modestly as possible. Egyptian medicine was surprisingly progressive about female physicians treating female patients, but Peseshet is male, and there are social protocols, and determines that she likely has some kind of uterine issue, maybe fibroids, maybe an infection. possibly early menopause. The Egyptians had a fairly sophisticated understanding of gynecology, all things considered. They even had a kind of pregnancy test that involved urinating on barley and wheat seeds. If the barley sprouted, it was a boy. If the wheat sprouted, it was a girl. And if neither sprouted, you weren't pregnant. Shockingly, the basic pregnancy detection part of this actually worked better than chance. Probably because pregnancy hormones affect seed germination. But this woman isn't pregnant. She's in pain, and Peseshet doesn't have great options. He prescribes a mixture of dates, frankincense, and beer to be taken internally. Basically pain management, and suggests she visit the temple of Isis to make an offering, because gynecological issues were often considered under the goddess's domain. He's not being dismissive. He genuinely believes this might help. And also, the priestesses at the temple of Isis sometimes had their own herbal knowledge and could provide additional support. The woman thanks him, pays him with a nice length of linen, and leaves. Peseshet makes a note on a piece of broken pottery and ostrakon, which is what you used when you didn't want to waste expensive papyrus about the case, in case she comes back and he needs to remember what he prescribed. By mid-morning, Peseshet has seen a child with a persistent cough, prescribed ground garlic and honey, told the parents to keep him. Out of the dusty wind, a young man with an abscess on his leg lanced it, cleaned it with beer and honey, wrapped it in clean linen, and said a prayer to Sekhmet, goddess of healing and also plagues, because she had her fingers in every medical pie, and an elderly scribe with failing eyesight. The scribe case is particularly sad. The man has spent his entire life reading and writing hieratic script by lamplight, and now, in his 60s, he can barely see. Cataracts, most likely. Peseshet knows that in the capital, in Memphis or Thebes proper, there are surgeons who can perform cataract operations. They literally had a copper needle to push the clouded lens aside, but it's risky, expensive, and not available here. So Peseshet does what he can. He prescribes a paste made from ground coal and antimony to be applied around the eyes, which will at least reduce inflammation and make the man more comfortable. He gently explains that the scribe's working days are probably over, and suggests he train an apprentice to take over his duties while he can still supervise. The scribe nods, looking tired and resigned. He pays Peseshet with a small roll of papyrus, a generous payment, actually, given how valuable papyrus is, and shuffles out. Peseshet sits down for a moment. It's not even noon, and he's already exhausted. The thing about being a physician in ancient Egypt, or really anywhere in the ancient world, is that you're constantly confronted with the limits of what you can do. You can set bones, sure. You can stitch wounds, treat burns with honey, prescribe pain relief, manage infections with whatever herbs and minerals you have available. But when someone comes to you with cancer, or advanced tuberculosis, or a complicated internal injury, or any of 1,000 other things, you're mostly just there, bearing witness, offering comfort, pretending you have more power than you do. It's a strange profession, medicine. You're expected to be confident, authoritative, knowledgeable, but secretly, privately, you're just doing your best and hoping it works. Around midday, Peseshet takes a break. He walks to the local market, buys himself some bread and a small grilled fish from a street vendor, and sits in the shade of a palm tree, watching the Nile flow by. The river is low right now. The inundation won't come for another few months. When it does, the fields will flood, the farmers will have a brief respite, and Peseshet will probably see an uptick in waterborne illnesses and accidents. Crocodile attacks, the occasional drowning, children falling into irrigation canals. The flood season always keeps him busy, but for now, it's dry, hot, and relatively quiet. He eats his lunch slowly, brushing away flies, and thinks about nothing in particular. After lunch, Peseshet returns to his small clinic, really just the front room of his house, where he sees patients and finds a teenager waiting for him. The boy has been bitten by a scorpion. This is not great. Scorpion stings are common in Egypt, and while most of them aren't fatal, some species are genuinely dangerous, especially to children and the elderly. Peseshet examines the sting site on the boy's foot. It's swollen, red, and the boy is sweating and nauseous. Peseshet works quickly. He makes a poultice of crushed onion and salt to draw out the venom. Does it actually work? Maybe a little. Placebo effect aside, and gives the boy a drink of beer mixed with a mild sedative herb to keep him calm and still. Then, because this is ancient Egypt, he also recites an incantation to Serket, the scorpion goddess, asking her to neutralize the venom. The boy's mother hovers anxiously. Peseshet reassures her in his calm, practiced way. He's seen dozens of scorpion stings. Most people survive. The boy is young and strong. He'll probably be fine. Probably the boy does, in fact, survive. By evening, his symptoms have improved, and Peseshet sends him home with instructions to rest and avoid putting weight on the foot for a few days. The mother pays him with a basket of onions and a small jar of oil, which Peseshet accepts graciously. As the sun begins to set, Peseshet sees his last patient of the day, a young woman with a broken finger. It's a clean break, probably from slamming it in a door or getting it caught in something. Peseshet sets it carefully, splints it with 2 small pieces of wood and strips of linen, and tells her to keep it immobilized for at least a month. She winces but nods. She pays him with beer. He now has more beer than he knows what to do with, but such is life. Finally, as the sky turns orange and purple and the evening breeze picks up, Peseshet closes up his clinic. He washes his hands again seriously. The Egyptians were very into hand washing, and sits down to eat a simple dinner of bread, onions, and lentils. His wife, if he has one, might be there, asking him about his day. Or maybe he's alone, a solitary physician in a modest house, content with his work and his reputation. Before bed, Peseshet takes out a piece of papyrus and makes notes on the day's cases. He sketches a diagram of the broken finger, notes the dosage of the sedative herb he used for the scorpion sting, writes down the incantation he recited for the headache demon. This is how medical knowledge is preserved, through careful documentation, passed down from master to apprentice, copied and recopied across generations. Peseshet knows that his work won't make him famous. He's not a royal physician, attending to the pharaoh and his family. He's not a surgeon performing dramatic operations. He's just a regular doctor in a regular town, doing regular work, but he's good at it. He helps people. He eases suffering. And in a world where life is short, disease is common, and death is always lurking just around the corner, that's not nothing. He lies down on his bed, a simple wooden frame strung with rope and covered with a linen sheet. The night is warm. Somewhere in the distance, a dog barks. The Nile murmurs. The stars come out, the same stars that will shine over Egypt for thousands of years, long after Peseshet is gone, long after his name is forgotten, long after the entire civilization he belongs to has crumbled into sand. But tonight, he's here. He's alive. He's done his job. And tomorrow, he'll wake up and do it all over again, because that's what physicians do. Now, you might think that being an Egyptian doctor was all poultices and incantations, but let me tell you about the paperwork. Because ancient Egypt loved paperwork the way a modern HOA loves filing complaints. Everything was documented, everything was recorded, and if you didn't have it in writing, it basically didn't happen. Peseshet, like all physicians of his era, was required to keep medical records. Not optional, required. The Egyptian bureaucracy extended into every corner of life, and medicine was no exception. If a patient died under your care, you needed to be able to prove you followed the proper procedures as outlined in the medical papyri. Otherwise, you could be accused of negligence or, worse, sorcery. The medical papyri. Let's talk about those for a moment. These were essentially textbooks, collections of medical knowledge compiled over centuries. The most famous one, the Edwin Smith Papyrus, wouldn't be written down in its surviving form for another century or so after Peseshet's time. But the knowledge it contained was already circulating, being copied and recopied by scribes and physicians. These papyri were organized by body part and ailment. Instructions concerning a wound in his head, one section might begin, and then it would walk you through the examination process, what to look for, what to touch, what questions to ask. Then it would give a prognosis, an ailment which I will treat, an ailment with which I will contend, or the deeply ominous an ailment not to be treated. That last one was code for this patient is definitely going to die, and you should not waste your time or reputation trying to save them. Harsh, maybe, but also practical. If you lived in a world without antibiotics, without surgical anesthesia beyond maybe getting someone drunk, without any real understanding of germ theory, you learned pretty quickly to recognize when someone was beyond help. And the medical papyri, in their dry, clinical way, taught physicians how to make that call. Peseshet had his own copies of certain sections, written out on papyrus scraps or astraca. He couldn't afford a full medical papyrus, those were expensive, rare, and usually kept in temple libraries or by wealthy court physicians, but he had the important parts, the sections on wounds, on broken bones, on common ailments. He'd memorized most of it anyway, but it was good to have a reference, just in case. On a slow afternoon, maybe a week after the day we just followed him through, Peseshet sits in his clinic reviewing his notes. He's preparing for a visit from a more senior physician, a man named Carr, who travels between towns inspecting the work of local doctors and making sure everyone is maintaining proper standards. This visit makes Peseshet nervous, not because he's been doing anything wrong, but because Carr has a reputation for being particular, exacting, the kind of man who will notice if you've been using too much of an expensive ingredient in your poultices, or if your handwriting on your medical records is messy, or if you've been deviating from the standard incantations. Egyptian medicine, you see, was a weird mix of empirical observation and religious ritual. On one hand, physicians were trained to observe symptoms carefully, to examine wounds, to track the progression of disease. On the other hand, they were expected to recite the proper prayers and incantations, because disease was often seen as having a spiritual component. This wasn't as contradictory as it might seem to a modern mind, if you believe that the body and soul are interconnected, and the Egyptians very much did then. It makes perfect sense to treat both simultaneously. Physical remedies for the physical symptoms, spiritual remedies for the spiritual causes. But it also meant that there was a right way to do things, and deviating from that right way could get you in trouble. Carr arrives in the late afternoon, carried into town in a small sedan chair by two bearers, because apparently he's too important to walk. He's older than Peseshet, maybe in his 50s, with the kind of severe face that suggests he has never found anything particularly amusing in his entire life. "Peseshet," he says, nodding curtly. "Carr," Peseshet replies, trying to sound confident and professional, and not at all like he has been anxiously cleaning his clinic all morning. Carr inspects everything. He examines Peseshet's tools, the copper knives, the bronze needles, the wooden splints. He checks the cleanliness of the linen bandages. He reviews the medical records, squinting at Peseshet's handwriting, and occasionally making a small, disapproving noise that could mean anything. "You've been seeing a lot of abscesses," Carr observes. "It's been a hot season," Peseshet says. "People are working in the fields, getting minor cuts, and they're not cleaning them properly. By the time they come to me, it's infected." Carr nods. "And you've been lancing them?" "Yes, cleaning with beer and honey, applying a poultice of ground beans and oil, bandaging with clean linen, standard procedure, incantation, to Sekhmet." "Yes." Carr makes a note on a small piece of papyrus. "Good. And your success rate?" Peseshet hesitates. This is a trick question. If he says his success rate is too high, Carr might not believe him. If he says it's too low, Carr might think he's incompetent. "Most recover," Peseshet says carefully. "Some require multiple treatments. One elderly man developed blood poisoning and died, but he'd waited nearly 2 weeks before coming to see me, and by then..." He trails off. Carr nods. "An ailment not to be treated." "Yes. Did you document that?" "Of course." Carr flips through Peseshet's records until he finds the relevant entry. He reads it, his expression unreadable, then sets it aside. Adequate. High praise. Coming from Carr. They continued the inspection. Carr quizzes Peseshet on various treatments, on the proper proportions of ingredients, on the correct wording of incantations. Peseshet answers as best he can, drawing on years of training and experience. Some questions he gets right immediately, some he has to think about. One or two he doesn't know, and he admits it honestly, because pretending to know something in front of Ka seems like a very bad idea. Finally, after what feels like hours, Ka seems satisfied. "You're doing competent work," he says, which is apparently the highest compliment he's capable of giving. "Your documentation is acceptable. Your technique is sound. You're perhaps a bit too generous with your use of frankincense. It's expensive, and you should reserve it for wealthier patients who can afford it, but otherwise, no major concerns." Peseshet feels a wave of relief, so intense it's almost dizzying. Ka stays for dinner, because apparently that's part of the inspection process, making sure the local physician can afford to feed a guest, which is a roundabout way of checking that you're being paid adequately for your work. Peseshet's wife, Neferet, prepares a modest but respectable meal: bread, roasted duck, a splurge, but necessary for the occasion, lentils, onions, and dates. Ka eats slowly, methodically, making no comment on the food, which Peseshet chooses to interpret as approval. Over dinner, Ka talks about the state of medicine in Egypt. It's not a cheerful conversation. "Standards are slipping in some of the smaller villages," Ka says, tearing off a piece of bread. "I visited a physician last month who was treating eye infections with ground bat dung." Peseshet blinks. Bat dung, bat dung. He claimed it was in an old papyrus he'd inherited from his teacher. I asked to see the papyrus. It turned out he'd misread the hieratic. It was supposed to be bat guano, mixed with honey and antimony, not just bat guano. He'd been skipping the other ingredients because they were expensive. Did it work? Of course not. Half his patients went blind. Peseshet winces. This is the nightmare scenario for any physician, doing something wrong, however innocently, and causing harm. The Egyptians took medical ethics seriously. There was an understanding that physicians held people's lives in their hands, and with that came responsibility. What happened to him? Removed from practice. He's working as a scribe now, probably for the best. Ka takes a sip of beer. The problem is that medical training is inconsistent. In the cities, you have proper schools, temple programs, apprenticeships with experienced physicians, but out in the villages, it's often just one doctor training one apprentice. And if that doctor learns something wrong, or if knowledge gets corrupted as it's passed down, mistakes happen. Peseshet nods. He'd been lucky. He'd trained in Thebes, at the Temple of Ammon, under several physicians. He'd learned from multiple sources, cross-referenced his knowledge, had access to a decent medical library. But he knows that not everyone has those advantages. The palace is talking about standardizing training. Ka continues. Creating a formal examination system. You'd have to demonstrate your knowledge before being licensed to practice. It would help ensure quality. It would also make it harder for poor students to become physicians, Peseshet points out. Ka shrugs. Perhaps, but is it better to have many poorly trained physicians or fewer well-trained ones? It's a question without a good answer, and they both know it. After dinner, Ka leaves, carried off in his sedan chair back toward the next town on his inspection route. Peseshet and Neferet clean up, and Peseshet feels exhausted in a way that has nothing to do with physical labor. He seemed pleased, Neferet offers. He said I was competent. For Ka, that's basically a love letter. She laughs softly. Will you get a written recommendation? Probably. It'll help if we ever want to move to a bigger city. Better patients, more interesting cases, higher fees. Do you want to move? Peseshet considers this. Part of him does. Honestly, he's good at what he does, and he knows he could handle more complex cases if he had access to better resources. But another part of him likes it here, in this small town where everyone knows him, where his patients trust him, where he's not competing with a dozen other physicians for the same wealthy clientele. I don't know, he says finally. Maybe someday. The next morning, Peseshet wakes to find a young man waiting outside his clinic. The man is well-dressed, a servant from one of the wealthier estates on the edge of town, and he looks anxious. My master's son is ill, the servant says. High fever, difficulty breathing. He's been sick for 3 days. My master requests that you come immediately. This is both an opportunity and a risk. Wealthy patients pay better, much better, but they also have higher expectations. If Peseshet succeeds in treating the boy, he'll gain a valuable patron. If the boy dies, even if there's nothing Peseshet could have done, he might be blamed. Still, you don't say no to a wealthy patron. Peseshet gathers his supplies, his medical bag with various herbs and minerals, clean linen for bandages, his copper instruments, and a small jar of honey. He follows the servant to a large, well-appointed house near the river. The house has multiple rooms, painted walls, actual furniture beyond the basics. This is the kind of family that can afford multiple servants, fine linens, imported luxuries. The boy, maybe 12 years old, is lying on a bed in a private room. His face is flushed, his breathing rapid and shallow. His mother hovers nearby, looking terrified. His father stands in the corner, arms crossed, expression carefully neutral. Peseshet examines the boy carefully. He checks the fever by feeling his forehead and chest. He listens to his breathing, noting the wet, rattling quality. He looks at his throat, which is red and swollen. He asks questions. When did the fever start? Has he been coughing? Has he vomited? Is there pain anywhere? The answers paint a clear picture. Some kind of respiratory infection, possibly pneumonia. This is serious. I'll need to stay here, Peseshet says. To monitor him the next day or two will be critical. The father nods. Whatever you need. Peseshet prepares a treatment plan. He makes a poultice of mustard seed and honey to place on the boy's chest to help break up the congestion. He prepares a tea of willow bark and mint to reduce the fever and ease the cough. He props the boy up with extra pillows to help him breathe more easily. And then, because this is Egypt, he recites an incantation to Sekhmet, asking the goddess to drive out the disease. The mother joins in the prayer, her voice shaking. For the next 2 days, Peseshet barely leaves the boy's side. He monitors the fever, changes the poultices, makes sure the boy drinks enough fluids. He sleeps in short intervals on a mat in the corner of the room. The servants bring him food, which he eats mechanically, barely tasting it. The boy gets worse before he gets better. On the second night, his fever spikes so high that Peseshet seriously considers telling the parents to prepare for the worst. But he doesn't. Instead, he applies cold compresses, forces more willow bark tea down the boy's throat, and prays. By the third morning, the fever breaks. The boy wakes up weak, confused, but alive. He asks for water. His mother bursts into tears. His father's carefully neutral expression cracks, and he grips Peseshet's shoulder with genuine gratitude. You saved him, the father says. Peseshet wants to say that he didn't. Really, that it was the boy's own body that fought off the infection. That Peseshet just helped manage the symptoms and kept him comfortable. But he knows that's not what the father wants to hear. And also, in a way, maybe it's true. Maybe his treatments did help. Maybe the prayers worked. Maybe the combination of practical medicine and spiritual intervention tipped the balance just enough. He'll need to rest for at least a week. Peseshet says instead, light meals, plenty of fluids, no exertion. And if the fever comes back, send for me immediately. The father nods. Of course, and your fee. This is the awkward part. How do you put a price on saving someone's child? Peseshet names a sum that's higher than his usual rate, but not extortionate. The father doesn't even blink. He pays it immediately, in actual copper, not grain or beer or onions. He also gives Peseshet a bolt of fine linen and a small jar of imported myrrh as additional thanks. Peseshet walks home feeling like he's floating. This is what it feels like to succeed, to genuinely help someone, to watch someone recover who might have died without your intervention. Of course, 3 days later, a farmer comes in with a badly infected wound that's already begun to necrotize, and despite Peseshet's best efforts cleaning the wound, applying every poultice he knows, saying every prayer in his repertoire, the man dies of blood poisoning. Such is medicine. You win some, you lose some, and the losses haunt you far more than the wins encourage you. About once a month, Peseshet makes a trip to the local temple of Ammon. This isn't optional. It's part of his professional obligations. Physicians in Egypt had a complicated relationship with temples. They weren't priests, exactly, but they weren't entirely separate from the religious establishment either. The temple serves several functions in Peseshet's professional life. First, it's where he goes to renew his supplies of certain herbs and ingredients that the temple grows or imports. Second, it's where he consults with the temple's priest-physicians about difficult cases. Third, it's where he makes offerings to the gods on behalf of his patients and himself. The Temple of Ammon in his town is not one of the grand temples you'd find in Thebes or Memphis. It's a modest structure, but still impressive by local standards. Stone walls, a columned hall, a sanctuary where the god's statue resides, and extensive gardens where medicinal plants are cultivated. Peseshet arrives in the late morning, bringing offerings, some of the copper he received from the wealthy patron, a jar of honey, and a bundle of fresh lotus flowers. The priest at the entrance, a young man named Amenhotep, greets him with a nod. Peseshet, here for your monthly consult, and to restock some supplies if possible. I'm running low on frankincense and myrrh. Amenhotep makes a note on a wax tablet. I'll have someone prepare a package for you. The usual amount. Actually, a bit more if you can spare it. I've been seeing more wealthy patients lately. He doesn't mention that. Carr specifically criticized him for being too generous with expensive ingredients with poor patients, but he's learning to be more strategic about resource allocation. Amenhotep leads him through the temple complex to the medical garden. It's a peaceful place, carefully maintained by a dedicated group of temple workers. They grow everything here: poppy for pain relief, castor plants for oil, garlic for infections, mint for digestive issues, aloe for burns. There's even a small section dedicated to plants that aren't native to Egypt, things that have been imported from Nubia, from Punt, from Syria. The head gardener, an elderly woman named Mutamoya, is directing a young assistant in the proper way to harvest poppy sap. She looks up as Peseshet approaches. "Ah, our good doctor, come to steal my plants again." It's a running joke between them. "Only the ones you're willing to part with." She laughs, a sound like dry leaves rustling. "What do you need?" They walk through the garden together, and Peseshet points out the plants he's running low on. Mutamoya makes mental notes, occasionally instructing her assistant to prepare cuttings or dried samples. As they walk, she asks about his cases, and he describes them in general terms, no names, no specific details, but enough that she can offer advice if she has any. "That respiratory infection you treated," she says thoughtfully. "Did you use hyssop in your poultice?" "No, just mustard seed and honey. Hyssop is excellent for lung complaints. Helps clear the passages. I'll add some to your package." This is one of the benefits of the temple connection. The priests and priestesses, especially those who work with the medicinal gardens, often have knowledge that doesn't appear in the standard medical practical hands-on knowledge passed down through generations of growing and experimenting with plants. After collecting his supplies, Peseshet makes his way to the temple library. This is the real treasure. The temple has a small collection of medical papyrus copies, of texts that date back hundreds of years. Peseshet isn't allowed to take them out, but he can consult them here, under the watchful eye of the librarian priest. Today, he's looking for information about a case that's been puzzling him. One of his regular patients, an older woman, has been experiencing episodes of dizziness and confusion. She'll be fine for days or weeks, and then suddenly she'll become disoriented, unable to recognize her own family, speaking in confused fragments. Then, just as suddenly, she'll return to normal. Peseshet suspects it might be related to her heart. The Egyptians believed the heart was responsible for thought and emotion, and they'd observed that damage to the heart could affect a person's mental state, but is not sure how to treat it, or even if it can be treated. He unrolls one of the medical papyri. Carefully, these are fragile, precious documents, and begins to read. The hieratic script is cramped and sometimes difficult to interpret, but he's had years of practice. There, a section on wandering of the heart-mind. It describes symptoms similar to what his patient is experiencing. The recommended treatment is not encouraging. Amulets, prayers, dietary restrictions, essentially palliative care. The prognosis is listed as an ailment with which I will contend, which is better than an ailment not to be treated, but not by much. Still, it's something. Peseshet makes notes on a piece of broken pottery he's not important enough to waste papyrus on personal notes and carefully rolls up the medical text. As he's leaving the library, he runs into one of the priest physicians, a man named Neberman. Neberman is older than Peseshet, more experienced, and serves as an informal mentor to the local physicians. Peseshet, good to see you. How goes the practice? Busy car came through for his inspection last week. Ah, and you survived. Barely, he said. I was competent. Neboman grins. High praise indeed. Listen, I wanted to ask you about something. We've had several cases at the temple recently of a particular skin condition. Read. Scaly patches, mostly on the elbows and knees, very itchy. We've tried the usual treatments, but nothing seems to help. Have you seen anything like that? Peseshet thinks. No, not recently. What have you tried? Aloe, honey, ground malachite, paste, castor oil. Nothing works for more than a day or two, and it's multiple people. Not just one person with a unique condition. At least 5 cases in the last month. All adults, different ages, different occupations. No obvious connection. This is interesting. Potentially the beginning of an outbreak of something. Or possibly just a coincidence. Sometimes the same condition appears in multiple people at the same time, for no clear reason. I'll keep an eye out. Peseshet says, if I see any cases, I'll let you know. Maybe if we compare notes, we can figure out what's causing it. Appreciated. This is another benefit of the temple connection. Information sharing. Physicians in Egypt don't really compete with each other the way they might in other cultures. There's a sense of collective responsibility, of working together to advance medical knowledge. It doesn't always work. There are definitely rivalries and disagreements, but the ideal is there. Peseshet leaves the temple as the sun is beginning its descent toward the western horizon. He walks slowly through the town, his bag heavier now, with fresh supplies, his mind turning over the cases he's seen, the information he's gathered, the questions he still doesn't have answers to. He passes the market, where vendors are beginning to pack up for the day. He passes the house where the wealthy boy is recovering. The father sees him and waves, a gesture of gratitude and respect. He passes the small shrine to Toaret, goddess of childbirth, where a pregnant woman is leaving an offering. This is his world. This small town on the Nile where everyone knows everyone, where life moves to the rhythm of the river and the seasons. Where people are born and get sick, and sometimes get better, and eventually die, and Peseshet is there for all of it, doing what he can with the limited tools and knowledge available to him. It's not glamorous, it's often frustrating, but it's meaningful. And for Peseshet, that's enough. 2 weeks after his temple visit, Peseshet is woken in the middle of the night by frantic pounding on his door. This is never a good sign. No one disturbs a physician in the middle of the night unless something is seriously wrong. He stumbles out of bed, throws on his kilt, and opens the door to find a young man, barely more than a teenager, looking absolutely terrified. It's my wife, the young man gasps. The baby. It's been hours, and the midwife says something's wrong, and my wife is screaming, and there's so much blood, and please, please, you have to help. Childbirth. Of course it's childbirth. Peseshet grabs his bag and follows the young man through the dark streets. The moon is nearly full, which helps, but he still stumbles over uneven ground twice. His mind is already running through possibilities, none of them good. Childbirth in ancient Egypt is dangerous, even with skilled midwives, and Egypt has some of the best in the ancient world. Things can go wrong. Babies can be positioned incorrectly. Labor can stall. Women can hemorrhage, infections can set in. Physicians aren't usually called for childbirth. That's the midwife's domain. The fact that the midwife has sent for him means she's encountered something beyond her expertise. They arrive at a small house. Peseshet can hear the woman screaming before he even enters. Inside, it's chaos. The midwife, an experienced woman named Torota, named after the goddess of childbirth, is trying to stay calm, but Peseshet can see the fear in her eyes. The laboring woman is on a birthing brick, the traditional setup, but she's clearly exhausted, her face pale and streaked with sweat. The baby's stuck, Torota says, without preamble. Shoulder presentation. I can't turn it. I've tried everything. Peseshet's heart sinks. Shoulder presentation. When the baby is positioned sideways instead of head first or feet first is one of the worst scenarios in childbirth. In most cases, both the mother and baby die. There are procedures to try to manually turn the baby, but they're difficult, painful, and often unsuccessful. How long has she been in labor? Since yesterday morning. She's been pushing for hours. Too long. Way too long. Peseshet approaches the woman carefully. Her name is Hathamet, he learns. She's young, maybe 16. This is her first child. She looks at him with eyes that are barely focusing, delirious with pain and exhaustion. I'm going to help you, he says, trying to sound more confident than he feels. But I need you to listen to me and do exactly as I say. Can you do that? She nods weakly. Peseshet examines her, as gently as possible under the circumstances. Torita is right. The baby is sideways, one tiny shoulder wedged into the birth canal. He can feel it. This is bad. This is really, really bad. He has a few options, none of them good. He can try to manually turn the baby, but if he fails, he might injure the mother internally. He can try to push the baby back up and attempt to reposition it, but again, risky and painful. Or he can do nothing and watch both of them die. I'm going to try to turn the baby, he tells Torita quietly. I'll need you to hold her steady, and I'll need someone to pray continuously, to Tuaret, to Hathor, to anyone who might be listening. The young husband, who's been hovering uselessly in the corner, immediately begins muttering prayers. Peseshet prepares himself. He coats his hands in oil to help them slip more easily. He instructs Hathamet to breathe slowly, to try to relax her muscles as much as possible. Then, carefully, gently, he reaches in and tries to feel the position of the baby more precisely. It's a boy, he can tell. A small boy, which might actually help less mass to maneuver. He can feel the shoulder, the tiny arm. Slowly, he applies pressure, trying to guide the shoulder up and the head down. The woman screams. Peseshet's arms are shaking with the effort of being simultaneously firm enough to actually move the baby and gentle enough not to cause permanent damage. Minutes pass, or maybe hours. Time becomes meaningless. And then a shift, a tiny movement. The shoulder slides up slightly. Peseshet adjusts his grip, changes the angle of pressure. Another shift. The baby is moving, rotating. Come on, come on. Suddenly, the baby turns. The head is down. It's in the correct position. Now, Peseshet tells Hathamet, push now, as hard as you can. She does. And this time, with the baby correctly positioned, it works. The head emerges, then the shoulders, and then Torita catches the entire tiny, slippery body. The baby lets out a wail. He's alive. He's actually alive. But they're not done. Hathamet is still hemorrhaging. There's too much blood. Peseshet works quickly, helping to deliver the afterbirth, checking for tears that need to be stitched. Torita prepares a poultice of honey and ground myrrh to place internally, to help prevent infection and slow the bleeding. They work together, physician and midwife, using every technique they know. Slowly, gradually, the bleeding slows. Hathamet's color begins to return. She's going to survive. Peseshet sits back, his hands covered in blood and oil, and lets out a breath he didn't realize he'd been holding. The young husband is crying, holding his son. Hathamet is exhausted, but smiling weakly. Torita is cleaning up, her hands steady, despite the trauma they've all just experienced. You saved them, the midwife says quietly. Both of them. I couldn't have done that alone. You could have, Peseshet says. You would have found a way, but they both know that's probably not true. Peseshet stays until dawn, monitoring Hathamet to make sure the bleeding doesn't start again, checking that the baby is nursing properly. Before he leaves, he gives Torita instructions for ongoing care, what to watch for, what herbal teas to give, when to send for him if complications arise. The young husband tries to pay him. He has almost nothing, a few copper debens, probably his entire savings. Peseshet accepts only 1 deben, about half the usual fee for a routine house call, and certainly nowhere near adequate payment for saving 2 lives in the middle of the night. The rest, when you can afford it, he says. No hurry. He knows he'll probably never see the rest of the payment. That's fine. As Peseshet walks home through the morning streets, watching the sun rise over the Nile, turning the water gold and pink, he feels complicated, relieved, certainly, proud, maybe, but also shaken. It had been so close. If the baby had been positioned just slightly differently, if he'd made one wrong move, if he'd been called even an hour later. This is the reality of medicine in the ancient world. You do everything right, and people still die. You make a tiny mistake, and people die. Sometimes, through sheer luck, everyone survives, and you never quite know which it's going to be until it's over. Back home, Neferet is already awake, preparing breakfast. She takes one look at him covered in blood, exhausted, probably looking like he's aged 10 years over. Nighthand immediately pours him a cup of beer and pushes him toward the washing basin. Bad, she asks. Nearly, but not. Mother and baby both survived. Good. She doesn't ask for details. She's learned over the years that sometimes he needs to talk about his work, and sometimes he needs to not think about it at all. Peseshet doesn't get to rest for long. By mid-morning, despite having been up all night, he has patients waiting. Word has spread about the successful birth. Good news travels fast in a small town. Nan. Suddenly, everyone wants to see the physician who can work miracles. Except they weren't miracles. They were technique, training, experience, and a significant amount of luck. But Peseshet knows better than to say this out loud. Let people believe what they want to believe. Faith in your physician is itself a kind of medicine. His first patient of the day is an elderly man with chronic joint pain. This is one of the most common complaints Peseshet treats, and also one of the least satisfying, because there's not much he can actually do about it. The Egyptians understood that joints deteriorate with age, and they'd seen it in enough elderly people, in enough mummified bodies prepared for burial. But understanding what causes something doesn't mean you can fix it. It's worse in the mornings, the old man says, flexing his gnarled fingers. And when the weather changes, when the wind comes from the north, I can barely move. Peseshet examines the joints carefully. They're swollen, warm to the touch. Definitely inflammation. He's seen hundreds of cases like this. I can give you something for the pain, he says. Willow bark tea, twice daily. And I'll prepare a poultice of ground beans and honey to apply to the joints at night. It won't cure the condition, but it should help with the discomfort. That's all you can do. The old man sounds disappointed but not surprised. I'm sorry. The wearing away of the joints it's part of aging. I can manage the symptoms, but I can't restore what's been lost. This is one of the hardest parts of being a physician, having to tell people that some conditions couldn't be fixed, that sometimes all you can offer is comfort, not cure. The old man nods slowly. My father had the same. He could barely walk by the end. I suppose I should be grateful I've made it this far. He pays in barley, a generous amount, and Peseshet prepares the willow bark tea and shows him how to make the poultice. As the man leaves, Peseshet finds himself wondering, not for the first time, if there might be better treatments that he simply doesn't know about. Maybe in the great medical centers in Memphis or Alexandria, physicians have discovered techniques he's never heard of. Maybe there are remedies in the papyri he hasn't had access to. Or maybe this is just one of those things that medicine can't fix, no matter how advanced it becomes. His next patient is more interesting. A young woman with a persistent cough and fatigue. She's been coughing for weeks, she says, and recently she's been coughing up blood. This is concerning. Blood in the sputum can mean many things, none of them good. Peseshet examines her carefully. She's thin, pale, and when he listens to her breathing, he can hear a wet, congested sound in her lungs. He asks about her living conditions. Does she live in a damp house? Is there poor ventilation? Has anyone else in her family been sick? Yes, she says. Her younger brother died last year of a wasting illness. Similar symptoms. Peseshet's heart sinks. This sounds like consumption, what future ages will call tuberculosis. It's contagious, progressive, and usually fatal. There are treatments that might slow its progress, but no cure. I'm going to prepare a treatment for you, he says carefully. honey mixed with garlic and onion to help clear your lungs, and I want you to spend as much time as possible in fresh air, away from smoke and dust. Rest as much as you can. Eat well meat, if you can afford it, eggs, milk." She nods, but he can see in her eyes that she understands what he's not saying. She's seen this before, with her brother. "How long?" she asks quietly. Peseshet doesn't insult her intelligence by pretending to misunderstand. "I don't know. Some people live for years with this condition. Some decline quickly. There's no way to predict. Will I suffer? There will be pain. Yes, I can help manage it. But I won't lie to you, this is a serious illness." She takes this information with remarkable composure. "Thank you for your honesty." After she leaves, Peseshet sits for a moment, staring at nothing. This is the other hard part of medicine, knowing that you're rewatching someone die in slow motion, and there's nothing you can do to stop it. You can ease their passage, make them more comfortable, but you can't save them. It's days like this when Peseshet wonders if he chose the right profession. But then, a child comes in with a simple ear infection, and Peseshet treats it successfully with garlic oil drops. And the child's mother is so grateful, she nearly weeps. And Peseshet remembers why he does this. Because even if you can't save everyone, you can save some people. And that has to be enough. By late afternoon, Peseshet is seeing a steady stream of minor complaints. Headaches, stomach aches, minor cuts and burns, skin rashes. This is the bread and butter of his practice. These are the cases where he can actually help, where his treatments are effective and his patients recover. One man has an infected cut on his hand from a farming accident. Peseshet cleans it with beer. The alcohol helps prevent infection, though the Egyptians don't understand why applies honey, which is genuinely antibacterial, and bandages it with clean linen. He instructs the man to keep it clean and dry, and to return in 3 days for him to check on it. A woman brings in her young daughter who has been complaining of stomach pain. Peseshet examines the child gently, asking where it hurts, whether she's been vomiting, whether she's been able to eat. Based on the symptoms, he suspects it's just constipation. He prepares a mild laxative castor oil mixed with honey to make it more palatable and suggests the mother makes sure the child drinks plenty of water and eats more vegetables. A teenage boy has a painful boil on his neck. Peseshet lances it carefully, drains the pus, cleans the wound, and applies a poultice. The boy winces but doesn't cry out. Peseshet approves the kid is tougher than he looks. It's routine, methodical work. Not exciting, not dramatic, but necessary. This is what medicine actually looks like most of the time. Treating common ailments, managing chronic conditions, offering reassurance and practical advice. As the sun begins to set and the last patient leaves, Peseshet sits in his clinic and updates his medical records. He notes each case, each treatment, each outcome. This documentation is important, not just for cars inspections, but for his own learning. When he reviews his records, he can see patterns, which treatments work most consistently, which conditions are most common during which seasons, which of his patients are improving and which are declining. Medicine, he's learned, is as much about observation and record keeping as it is about treatment. You learn from your successes and your failures. You adjust your approach based on what works and what doesn't. You accumulate knowledge slowly, case by case, patient by patient. As he's finishing his notes, Neferet brings him dinner, bread, cheese, and onions. Simple fare, but welcome. He eats slowly, mechanically, his mind still partially on his patients. "You're thinking about the girl," Neferet says. "It's not a question, the one with consumption." "Yes." "Can you help her?" "Not really. I can make her more comfortable, but..." He trails off. Neferet nods. She understands. She's been married to a physician long enough to know that sometimes there are no good answers. "You do what you can," she says simply. "That's all anyone can ask." It's true, but it doesn't always feel like enough. The next week brings a welcome distraction, the festival of Opet. This is one of the major religious festivals in Thebes and the surrounding region, celebrating the journey of the god Amin from Karnak to Luxor. For 11 days, the normal rhythms of life are disrupted. Work stops, or at least slows considerably. There are processions, offerings, public celebrations, and general festivities. For Peseshet, this means a dramatic decrease in his regular patient load. People are too busy celebrating to worry about minor ailments, but also a predictable increase in certain types of problems. Festival injuries, basically, people drinking too much beer, getting into fights, having accidents during the celebrations. On the first day of the festival, Peseshet positions himself near the temple, where he knows the celebrations will be most intense. He brings a portable medical kit, bandages, honey, wound cleaning supplies, willow bark for hangovers. He's done this enough times to know what to expect. The procession is spectacular. The statue of Amun, housed in an ornate portable shrine, is carried by priests from the main temple through the streets, accompanied by musicians, dancers, and crowds of celebrating townspeople. The air is thick with incense smoke and the smell of roasting meat from the numerous offerings and public feasts. Peseshet watches from the sidelines, keeping an eye out for anyone who might need medical attention. The first casualty of the day is a young man who's clearly had far too much beer and has fallen into a decorative pool, hitting his head on the stone edge. Peseshet patches him up. It's just a minor cut. Looks worse than it is, due to all the blood, and sends him home with instructions to rest and, for the love of all the gods, stop drinking. The second is a child who's gotten separated from his parents and is crying hysterically. This isn't exactly a medical emergency, but Peseshet helps anyway, finding a temple official who can reunite the child with his family. The third is more serious, an elderly woman who's collapsed from heat exhaustion. The day is hot, the sun is intense, and she's been standing in the crowd for hours. Peseshet moves her to the shade, gets water into her, and monitors her until her color returns and she's able to stand again. He lectures her gently about the importance of staying hydrated and taking breaks during the festival, and she nods apologetically. By midday, Peseshet has treated a broken finger. Someone got it caught in a door during the crowd surge. 2 cases of acute intoxication, one of whom vomited on Peseshet's sandals, which was unpleasant, and a woman who fainted from the combination of heat, excitement, and probably not having eaten enough breakfast. This is festival medicine, mostly minor, mostly preventable, but necessary nonetheless. During a lull in the action, Peseshet allows himself to actually watch some of the festivities. The dancers are impressive, their movements synchronized and graceful. The musicians play traditional songs that everyone knows, and the crowd sings along. There's a sense of communal joy, of shared celebration, that's genuinely moving. For a moment, Peseshet allows himself to just be a person, not a physician, to enjoy the music, the spectacle, the sense of being part of something larger than himself. Then someone nearby shouts that a man has been injured in a beer hall brawl, and Peseshet is back to work. The brawl injury is actually fairly serious, a deep cut on the man's arm from a broken pottery vessel. It's bleeding heavily, and the man is drunk and belligerent, which makes treatment difficult. Peseshet enlists help from 2 strong bystanders to hold the man still while he cleans and stitches the wound. The man yells and curses throughout the procedure, but Peseshet has developed a thick skin about such things over the years. "You're an idiot," Peseshet tells him, matter-of-factly, as he ties off the stitches. "And if this gets infected because you were too drunk to keep it clean, that's on you. Come see me in 3 days so I can check on it, if you're sober." The man grumbles but eventually nods. By evening, Peseshet is exhausted. He's treated more patients in 1 day than he usually sees in 3, and all while standing in the hot sun, surrounded by noise and crowds and the overwhelming smell of incense and roasting meat. But there's something satisfying about it too. This is medicine stripped down to its essentials. See the problem, fix what you can, move on to the next person. No complicated diagnoses, no chronic conditions you can't cure, no ethical dilemmas, just practical, immediate care. As the sun sets and the festival celebrations shift from daytime processions to evening feasting and entertainment, Peseshet packs up his medical kit and heads home. He's tired, his feet hurt, and he smells like a combination of blood, beer, and incense. But he's also content. He did good work today. He helped people. That's not nothing. Neferet takes one look at him and points toward the washing basin without a word. Peseshet gratefully washes away the day's accumulated grime, changes into a clean kilt, and joins her for a simple dinner. "How was the festival?" she asks. "Chaotic, drunk, exactly as expected. Many injuries, enough to keep me busy, nothing too serious, fortunately. How was your day?" She tells him about her own day. She'd been helping at one of the public feasts, distributing bread to the poor, which was part of the festival tradition. It had been hot and crowded, but also rewarding, seeing people who usually struggled getting to enjoy a proper meal. They eat in comfortable silence for a while, the sounds of continued celebration drifting in from the streets. The festival will go on for days yet, and Peseshet will likely be kept busy the entire time. But for now, for this moment, he can rest. The next morning, Peseshet returns to his post near the temple. The second day of the festival is, if anything, more chaotic than the first. People have had a full day to get properly drunk, tensions are higher, and the heat is oppressive. Peseshet treats a split lip from a fight, a sprained ankle from someone falling during a dance, and a particularly unpleasant case of someone who ate something that didn't agree with them and is now experiencing violent digestive distress. That one, he mostly just offers sympathy and suggests staying near a toilet for the foreseeable future. Around midday, something more serious happens. A young boy, maybe 8 years old, has climbed one of the decorative columns near the temple, showing off for his friends. Probably, and has fallen. He's conscious but clearly in pain, and his arm is bent at an unnatural angle. Peseshet kneels beside him, speaking calmly and gently. "I'm a physician. I'm going to help you. Can you tell me your name?" "Kenti," the boy gasps. "Okay, Kenti, you've broken your arm. I'm going to have to set it, which is going to hurt, but then it will feel better. Can you be brave for me?" The boy nods, tears streaming down his face. Peseshet works quickly. He has someone bring him to straight pieces of wood for a splint. He carefully feels the break gets clean, fortunately, not compound, and then, with one swift, practiced motion, he sets the bone back into alignment. Kenti screams. His mother, who has just arrived, screams too, but it's done. Peseshet quickly splints the arm, wrapping it securely with linen bandages, and gives the boy a small amount of poppy tea for the pain. "Keep the splint on for at least a month," he tells the mother. "Bring him to my clinic in a week, so I can check on it. Make sure he doesn't use the arm at all, and maybe keep him from climbing columns in the future." The mother nods vigorously, clutching her son. Thank you so much. I thought when I saw him fall, he'll be fine," Peseshet assures her. "Children heal quickly. The arm will be as good as new, probably. Most broken bones in children do heal well. But there's always a chance of complications, of the bone healing incorrectly, of permanent damage." Peseshet doesn't mention this. The mother is already frightened enough. The festival continues. Days blur together in a haze of minor injuries, overindulgence, and the occasional genuinely serious case. By the time the 11 days are over, Peseshet is utterly exhausted, but also richer than usual. Festival medicine pays well, since people are in generous moods and willing to pay premium rates for immediate care. He uses some of the extra income to buy Neferet a nice gift, a beautiful linen shawl dyed with expensive blue pigment. She protests that it's too extravagant, but he can see she's pleased. For himself, he purchases a new medical text from a traveling merchant, a copy of sections from the Ebers Papyrus, dealing with diseases of the skin and eyes. It's expensive, but worth it. Knowledge is always worth the investment. A few weeks after the festival, Peseshet receives unexpected news. A high-ranking official from Thebes will be passing through the region and has requested a consultation. Apparently, the official suffers from chronic digestive problems and wants to consult with local physicians to see if anyone has effective treatments. This is both an opportunity and a source of anxiety for Peseshet. Treating a high-ranking official successfully could significantly boost his reputation and potentially lead to a position at a larger medical center. Treating them unsuccessfully could. Well, it's best not to think about that. The official arrives in an elaborate sedan chair, accompanied by several servants and guards. His name is Amenemope, and he holds the title of overseer of granaries for the southern district. He's middle-aged, well-fed perhaps to well-fed, and has the bearing of someone accustomed to being obeyed, without question. Peseshet greets him with appropriate deference, inviting him into the clinic. Amenemope looks around with barely concealed disdain at the modest surroundings, but says nothing. "I understand you have digestive complaints," Peseshet begins, once they're seated. "For years," Amenemope says, "I've consulted every physician in Thebes. They've given me countless remedies, none of which work. I have pain here," he gestures to his upper abdomen, "especially after eating. Sometimes I vomit. I'm frequently bloated and uncomfortable." Peseshet asks the usual questions. What foods make it worse? Does the pain come and go, or is it constant? Are there certain times of day when it's worse? Has he noticed any blood in his vomit or stool? As Amenemope answers, a picture emerges. The pain is worst after rich, fatty meals. It's centered in the upper right quadrant of the abdomen. He's never vomited blood, but he does experience nausea frequently. This sounds like a problem with the gallbladder to Peseshet, though the Egyptians don't have a clear understanding of what the gallbladder does. They know it exists, they remove it during mummification, but its function is mysterious to them. "I believe," Peseshet says carefully, "that the issue is related to your consumption of rich foods. The seat of your pain suggests involvement of the organ we call the bitter vessel. This is the Egyptian term for the gallbladder, named for the bitter bile it contains." "So what do you recommend?" Amenemope asks impatiently. "Dietary changes, primarily. Avoid fatty meats, rich sauces, excessive beer. Focus on vegetables, fruits, lean fish, bread. I can also prepare a tea that may help ease your symptoms." Amenemope looks distinctly unimpressed. "Every other physician has told me to change my diet. I'm asking for actual medicine." Peseshet takes a breath, choosing his words carefully. "With respect, my lord, if every physician you've consulted has given you the same advice, perhaps that advice is worth following. I can give you medicines to manage your symptoms, and I will, but if you continue eating foods that aggravate the condition, the symptoms will continue to return." There's a long, tense silence. For a moment, Peseshet wonders if he's just committed career suicide by essentially telling a high-ranking official that his health problems are his own fault. Then, surprisingly, Amenemope laughs. It's a short, sharp bark of a laugh, but it's genuine. "You have courage, physician, I'll give you that. Most of your colleagues in Thebes tell me what they think I want to hear, not what I need to hear." "Very well, give me your medicine and your dietary advice, and I'll actually try following it this time." Peseshet prepares a mixture of mint, chamomile, and ground cumanol, of which can help settle the stomach, and writes out detailed dietary instructions on a piece of papyrus. He emphasizes which foods to avoid and which to embrace. He suggests smaller, more frequent meals rather than large feasts. Amenemope accepts the medicine and the instructions with uncharacteristic graciousness. "If this works," he says, "I'll ensure you're rewarded appropriately. If it doesn't," he leaves the threat unfinished, but the implication is clear. After he leaves, Peseshet sits down, feeling suddenly shaky. That could have gone very badly. It still might, depending on whether Amenemope actually follows the dietary advice, or decides that one more rich meal won't hurt, and ends up in agony again. But he did what he could. He gave honest advice based on his knowledge and experience. The rest is up to the patient and the gods. 3 weeks later, a messenger arrives with a substantial payment from Amenemope and a note thanking Peseshet for his effective treatment. Apparently, the dietary changes actually worked. Who knew? The payment is generous, more generous than Peseshet has ever received for a single consultation. It's enough to consider saving toward that potential move to a larger city that he and Nefret have sometimes discussed. Or maybe enough to expand his clinic, take on an apprentice, invest in better equipment, and a more complete medical library. Peseshet holds the copper, feeling its weight, considering the possibilities, but that's a decision for another day. For now, he has patience waiting.